All right, we are live.
Hello, everybody. Excuse our tardiness if you are live watching. Otherwise, if you're watching later, hello. Anyway.
Yeah, you have no idea.
Yeah.
You have no idea we're late.
Yeah.
Technical difficulties, and Dr. Katie's just too popular for her own good.
But it's wonderful and such a blessing. Welcome to Blunt and Biased, Frank Facts with Theresa Paganini and me, Dr. Katie Schneller. I'll introduce myself first and then we'll get going. But I'm a naturopathic physician practicing in Tempe, Arizona, and I do a lot of gut health, a lot of autoimmune in general, just helping people discover the cause of what's wrong, how they're feeling, and then helping to heal them and help support their body to heal itself. And my partner in crime, Theresa Paganini.
Yeah, so I own Love Yourself Lean, and I help people that struggle with the mindset side of battling with obesity, the disordered relationships with food. Food's the enemy. Food is bad. I have to starve myself. I'm not good enough. I'm never thin enough. Like all of the baggage that's in our head. I help people kind of work through the baggage to be able to create a healthier relationship with food, so that way they can lose weight in a healthy manner, in a joyous manner, and in a sustainable manner.
Yeah, it's wonderful.
Speaking of which, I haven't seen you since our last broadcast,
Yes.
which has been a month. We
Oh,
were
yeah.
supposed to do lunch and couldn't. A little bit of a family emergency, so
Yes.
that didn't happen. But I'm not sure I would recognize you.
Is it my glasses?
No, you look so. You've lost. How much weight have you lost?
So on semaglutide, I've lost about 20 pounds now.
I was gonna say your face is so tiny.
Thank you. This is how
It's
normally.
so little. I was gonna say I don't know that I'd recognize you.
It's been a great experience so far. So, and hopefully we'll get to talk about it today because our topic is naturopathic modalities and kind of when to use what, because there's so much information out there and there's so many different options. And sometimes when I provide treatment plans for my patients that are anywhere between 4 to 7 pages long, there's a lot in there and there's a lot to digest. But the whole point of naturopathic medicine and how I think all medicine should be is that it's individualized to you and it's about what you want and what you decide as a team with your provider. So,
Yeah.
yeah, where do you want
So
to start?
So what spurred this topic? This was a Teresa brainchild because right now my nephew is battling cancer, and so all the Western side medicine seems to have failed, and so moving more towards the Eastern side, and so he's doing light therapy, and then he wants to do vitamin therapy, and then it's recommended he do ozone therapy, and so then he's asking me because like, Auntie, this is your field, what does this stuff do? And I'm like, oh, shit, I don't know. Like, I've heard of it. I don't know. Like, I don't know which one you should be doing or why. So
Yeah.
this is what sparked this, because I am in the industry and I've partnered with you. I've done an IV, I've done ozone therapy, like I've done this stuff. But when do you do which? What is homeopathy versus just naturopathy? Like
Mhm.
what is all this stuff?
Yes.
So that's kind of what started this. I'm thinking there, like, what are the top five most common from an IV? Is it ozone therapy? Like, what are the five top most common things? And then what's the difference? Why would I choose IV over ozone versus IV? That kind of stuff. Like, let's
Mhm.
start there, like real high level.
Sure. Yeah. So I think first would be the terminology. So the words functional and integrative carry no like certification of any kind. I mean, there are courses that you can take in learning how to think more integratively or more functionally. But if you see anybody calling themselves a functional or an integrative doctor, that's more of a self designated title. Now, naturopathic medicine, I have my naturopathic doctorate. So I'm a doctor of naturopathic medicine, which means I practice functionally and I practice holistically and integratively, but those aren't separate designations or certifications that you can receive. So if you see that anywhere for anyone, it doesn't necessarily mean anything. It might just be that they're using that buzzword. So
And what does the buzzword mean? Functional versus integrative?
I don't know that there is any difference.
Okay.
Yeah. Yeah. They are, I would think that integrative means you're considering all systems at once and you are looking at a person as a whole, which is one of naturopathic medicine's core principles, is to treat the individual as a whole person. And then functionally might mean, we're thinking of not just, oh, you have knee pain, but what's going on in the body that's causing knee pain? Where else do we need to be looking, kind of thing. But really, there's not a ton of difference, I don't think.
Okay.
So a naturopathic doctor, because of our core principles and the way that we're trained to treat and diagnose, we could be considered functional or integrative practitioners. It's just that if you give up your title as a naturopathic doctor, then you're giving up, your kind of what you earned, So you can see MDs or DOs, like your standard other doctors, nurse practitioners. You can see other healthcare providers that say that they have holistic approaches or practice integrative medicine, but what that means can vary extremely widely. So naturopathic medicine also, in and of itself, that degree is not the same state by state. There are some states that still are not licensed. So we don't know, in certain states, you can only do certain things. In some states, you can't even touch your patient. You can't diagnose them. You can't say that you're treating anything. You just say that you're making recommendations. And that's if it's in an unlicensed state. There is a degree in naturopathy, which can be acquired through online courses, but that is nowhere near the same as a 4-year accredited medical school degree in naturopathic medicine. So in those unlicensed states, you have to be really careful, because as a common person, you're not going to know the difference in schools. Like, oh, was this school accredited or was this school not? So naturopathic doctor or naturopathic physician with the credentials ND or NMD. Arizona is usually one of the only states that does the NMD thing. So like a naturopathic medical doctor, are the things that you want to look for. Those are the credentials that you want to look for to make sure that your provider is a naturopathic doctor, not just a naturopath. Though we can be abbreviated as naturopath, but I do my best to, support others and to tell my patients, like, I'm a naturopathic doctor, not just a naturopath. In our, go ahead, please. Yeah.
Now, I say, so getting to the therapy side of it.
Yes. Yep.
What are common ones?
Yeah. So in Arizona, which was the whole lead in there. So we have the widest scope in Arizona. So I have the ability to prescribe everything up to Schedule 2 non-narcotics, which means hydrocodone basically is the upper limit of what I can call in a prescription for you for. We're trained as primary care, so we can do, antibiotics and some antidepressants and things like that. Like, we can do some of that primary care based stuff, but we are also trained in acupuncture and cupping. We are trained in herbal medicine. We are trained in homeopathy. And because of how popular homeopathy has been, that is not to be confused with a naturopath. A homeopath or a naturopath, totally different. A naturopathic doctor uses homeopathy as one of their tools. And of course, not everybody does, but we are taught that. We are also taught diet and lifestyle changes, of course, which are dependent upon blood results and existing diagnoses. Let's see what else we're taught. Physical medicine. So we can do manipulations like chiropractors. And then some people go on to get additional certifications in things like aesthetics. So Botox, filler, that kind of thing, as well as regenerative joint injection therapy. So things like PRP and Prolo. And then, of course, we do a ton with supplements. We can do some meds, like I already mentioned, and also IV therapy and vitamin injections. And not every naturopath is the same. Some of us use all of that. Some of us only use a few things.
So what are the top 5 things that are kind of all of that, right? That's all over the board. But
Mm-hmm.
I from my own experience, because I've probably seen a half a dozen naturopaths.
Mm-hmm.
Homeopathy is a big one.
Mm-hmm.
IV, vitamins a big one.
Mm-hmm.
Ozone's a big one.
Mm-hmm.
Um, Supplements, obviously a big one, but we've talked quite a bit of supplements. So I feel like that would be a bit redundant. We've kind of been
Right.
there.
Right.
But like, so that's that kind of stuff. Like I find like I have the similar, not experience per se, but there's like the pretty common stuff that comes up as options.
Mm-hmm.
So what is homeopathy? Since you said it's become pretty popular, but I remember I struggled to stay asleep, right?
Mm-hmm.
Like I could fall asleep. At one point I couldn't fall asleep. So the naturopath I was with at the time, we got me falling asleep. Well, then I couldn't stay asleep. So she made prescribed, I don't know what the hell you call it, these homeopathic beadlet thingies.
Uh-huh.
And she basically said, it'll give your body what it needs. I'm like, what does that mean? She's like, take the 4 or 5 of those if you wake up in the middle of the night, and it'll give your body what it needs to put it back to sleep. And I was like, what?
That's super descriptive.
So I was like, this sounds like witchery. What are you talking about? So that's where I'm like, I don't even understand what whatever, however you say that,
Yeah.
what it is,
Yeah.
what it does, why is it different than naturopathic medicine? Is it a supplement? Like, what is it?
We could totally start there. Yeah. So homeopathy, I almost feel like has given naturopathic medicine a bad name in a way. Not because it doesn't work. It definitely does if you get it right. So homeopathy, they are pellets, those little balls, and you can do homeopathy in a variety of different ways, but usually they're little pellets and they are massive dilutions from some other substance of something else. It can be from a flower, it could be from a poison, it could be from an animal. There are all sorts of different remedies. And the basis of homeopathy began when we started giving, not, we now, right, but hundreds of years ago, the doctors then, or the practitioners then, gave these remedies to healthy people to see what symptoms they developed. Homeopathy is extremely effective in cases that are very weird. So what I mean is, like, I have a left eye pain that twitches only when I'm in cold weather and I'm constantly craving sweets. Anytime patients say like super bizarre stuff, there is usually a remedy that matches their symptom picture better. The whole premise of homeopathy is that like cures like. So with someone whose left eye twitches, worse with cold, craving sweets, we find the remedy that in a healthy person, those symptoms are caused. So we're matching the symptom picture to the symptoms that are caused in a healthy person. There are different dilutions. So if you're, as a practitioner, if you're not super sure that it's the right remedy for them, you might start them at a 30C. There's also 60C, there's 200C, there's 1M, so on and so forth. So there's different strengths of homeopathy. And the idea is that as you peel back the layers for someone of their condition based off of like, this is happening, and then they're like, okay, that whole weirdness, that totally stopped taking this remedy. But now I'm dealing with lower right quadrant abdominal pain and I have a left toe twitch and, very bizarre kind of symptoms like this, very specifically weird. Homeopathy is great for that. Now, it doesn't have to be always that specific. Sometimes generalized anxiety about your family member's health can be fixed a lot with a remedy. So it's just one tool to use depending on how sensitive somebody feels that they are, how maybe energetically or like body systems aware they are. I did have a patient in clinicals who said that they were taking their homeopathy, and then by the end of the appointment, we had figured out that they were putting the pellets in the bathtub and trying to absorb them. So it's,
How cute.
I don't do a lot of homeopathy because I find it difficult to convince my patients of what it is because it's so dilute. There is currently with the tools that we have, an immeasurable amount of the medicine left. The medicine is on the outer coat of the pellet. So when you take the cap off, you twist 3 pellets into there, you take the cap off, you have to put it beneath your tongue. You can't touch it with your hands. It's just like you said, it's kind of like, sounds like witch medicine. So it's not that it doesn't work. I've seen it work a lot. I just don't tend to do it because I don't feel confident in explaining it. And I trained a lot in homeopathy. I was on a lot of homeopathy shifts. But so I would say, just broadly to answer your question, that we give homeopathy in very particular cases. And perhaps depending on the practitioner, you've tried everything else, nothing's really worked. Let's do the woo-woo stuff.
Got it. Okay. Yeah. So that's cool. That helps with that.
That's my opinion on it anyway. Yeah.
Hey, and yours is the only one that counts in this show. Right. So there you go. So let's talk then about vitamin therapy, especially because you've started a mobile unit. Yeah. So talk a little bit about what I'm talking about, like what is IV therapy, yep. The various types, and about your mobile unit.
Yeah. So we started Drive IV, which stands for Dr. IV with an E at the end. Get it? Dr. IV, Drive. And the goal is to bring IV therapy to the masses and help it to become more popular. The reason that I love IV therapy so much and why we started a mobile company for it is because so many people, this is why I treat so much of it, have digestive complaints. If you have any kind of digestive issues, there is a guaranteed amount, whether it's mild, moderate, or severe, where you're not absorbing the things that you should be absorbing. Your transport is messed up between your intestinal lining or your stomach lining, wherever the little receptors are, and your bloodstream. So with people that have any amount of digestive complaints, that can be reflux, that can be diarrhea, constipation, bloating, pain even, what you're taking and eating, what you're taking supplements wise and what you're eating, you may not be getting all of the good things from it that you want. And you may be getting extra bad stuff that you don't want. So IV therapy is so amazing because it gives your body what it requires to run its daily processes. So vitamin C, magnesium, zinc, B vitamins, right away to your bloodstream. It is instantly available. So for a lot of people, it helps them feel better faster. And of course, the hydration doesn't help. Lots of us are not drinking enough water. Lots of us are just drinking purified or reverse osmosis water without any other electrolytes or minerals in there. And so we're actually quite dehydrated, even if we feel that we're drinking a lot of water. So IV therapy is fantastic because it skips the whole mess of all of the malabsorption piece and gives you what your body needs right away. And so this can help things like fatigue and joint pain. It can help endurance and sports performance and recovery. It can help hangovers, all sorts of different things, giving your body what it needs right away without having to rely on your body absorbing. And really, nobody's absorbing 100% perfect.
Right. And then you've got like the glutathione push, and then you've got the, what's the other one? What's the more
NAD?
expensive one? NAD. There's also another one, isn't there? Myers. What's the Myers?
Oh yeah. The Myers is that's just a name some people use. It's not standardized across the board. So it can vary. The formula can vary, but it's usually vitamin C, magnesium, B complex, B12, that sort of thing. The vitamin thiamine or B1 is really good for hangovers. NAD is really good for making ATP, which is the body's cellular energy. So it's excellent for energy levels, for brain fog. But it helps everything because it's giving your body the cellular energy that it needs to run its everyday processes. And glutathione is fantastic because our body makes some of that. It's the master antioxidant of the body. So they're called free radicals, things that develop from toxins that we get exposure to from our food, from the air. It also supports the liver and lung function, but basically goes around like a Pac-Man and eats up all these free radicals and helps them get out of your body so that you are literally less toxic.
Awesome. So I'm hearing IV therapy is great for, one, if you have digestive issues and you don't feel like you're absorbing. 2, you've got a hangover, want to get past that quickly. 3, you need a big zap of vitamins quickly, like if you're not feeling well.
Yep.
4, low energy, right? right? Or 5, you need a greater antioxidant level for some reason or another. Like I'm thinking the NAD and the glutathione push
Mm-hmm.
would be great for Jordan, my nephew.
Mm-hmm.
He's been told he should do this IV therapy, and I'm like, okay, well, glutathione and the NAD is something you want to ask, see if it would be included because it's probably going to be beneficial for you.
Yes.
Yeah.
Yeah, for sure. Yeah. And then of course for performance or recovery. So prior to competitions, no matter what sporting event it is, also it's really good for helping with weight class for wrestlers because, a lot
Mm-hmm.
of people will cut weight and then they need to gain a little bit of weight. And so they'll do it the unhealthy way, but getting an IV bag can help you in a really lovely way meet your weight class.
Oh, that's cool.
Yeah.
Now, what about ozone therapy? Ozone therapy, nothing like
It's
IV therapy, even though it technically includes an IV, but
Yes, yeah, that's very different. So we basically we bloodlet you. Lots of your blood gets into a bag through tubing, and then there is a specific machine that produces ozone, which is a form of oxygen, basically. So you get these big syringes of oxygen. You push the ozone or the oxygen into the bag. You mix up the blood with the ozone. It makes everything really bright, really red, really oxygenated, and then you send the blood back into the body. So lots of people feel a ton of benefit. Same thing, same sort of things: energy levels, brain fog, recovery. Essentially, just helping your body do what it's supposed to do naturally. Ozone is also expensive, yeah, for that reason. It's like an expensive machine that puts out air, and then we put air into your blood, and then we give it back.
gotcha.
Yeah.
And so that one's really good. Like I remember one of the naturopaths that I had worked with, when I was fighting the flu, they were like,
Hmm.
get ozone therapy. That
Hmm.
will knock it right out.
Yeah, amazing for immune support, and lots of IVs are really. Again, same reason, it's readily available to your body. But yeah, the hyper oxygenated state of your red blood cells will flow with your red blood cells and also get oxygen into your cellular tissues, and that's of course something that's required for everything in the body too.
Gotcha.
Yeah.
Now, what about light therapy? I was unfamiliar with light therapy.
Yeah.
Um,
I don't do a lot of
so
it in the office, but it's same thing. Just it's not that it's new. It's actually one of the older technologies, but they're coming out with lots of different like infrared technology, light therapy and things like that. And there's also, of course, like infrared saunas and things. And so I actually don't know enough about that to talk about it. I don't do it in the office, but I've seen indications for that be mostly neuropathies, so like numbness and tingling.
hmm,
Um, and then, some people use it as a practice to like help their cells. And also I've seen it as like an energetic practice, like to like, cleanse your food kind of thing. But I can't speak to it beyond that. Actually, I don't know enough about it.
interesting. So this is one
Yeah.
of the therapies that Jordan is going through right now that they said it'd take about 30 days before he'd feel better.
Hmm.
Um, but I was like, he's asked me about it. I'm like, yeah, I don't know much about this one at all.
Yeah, yeah. There are.
Yeah.
I wish I knew more. There are companies that sell all sorts of different like expensive devices and all of the things. And um, yeah. But I haven't done it yet. Sorry for the beeps.
I was like, I thought my phone off. It's so loud that I was like, that's got to be mine, but I swear it's not lighting up. That's so funny.
Sorry, everyone.
Well, I have a headset in, so that makes everything loud. All right. So what else? Those are the top ones I was curious about. What are other modalities that that people are not aware of, or there's confusion around, um, that you can clarify naturopathically?
Um, I would say, I mean, it's not necessarily a treatment so much as it is a tool to use to help diagnose, and that is very individualized to you because again everything in naturopathic medicine is individualized. But I would say specialty testing, lots of people don't know that. Number one, before we get into specialty testing, that we run panels, most of us through insurance, not everyone, but a lot of us, that test your hormone levels and test your thyroid function and look at kidney and liver function and look at red blood cells and white blood cells. We know how to analyze all of those panels from not only are you normal, but are you optimal? And we are taught to follow and find trends over time. So instead of just, oh, hey, we drew your blood, I'm not going to tell you what's in your panel, but everything's fine. I don't know how many, I mean, hundreds of times I've heard that from patients that come in. We're not going to do that for you. At least I don't. I go one by one, make sure that you understand what everything is, what it means, what things I'm going to be looking for in the future, what we need to follow up on in 3 months, that kind of stuff. So we do really thorough preventative blood work or, blood work on following up to make sure whatever you're doing or taking or eating is safe for you. Additionally, we have access to all sorts of different specialty panels. We do stool testing. We do food sensitivity, food allergy testing. We do candida testing. We can test you for Crohn's. We can test you for SIBO. We do breath testing. We can send kits to your house to test your hair, to test your urine. We, of course, do urinalysis. I mean, not everybody does all these things in their office, right? But we have access and, heavy metal testing, mold testing, environmental toxin testing. There are just everything, an abundance of let's get to the root cause labs that we can run and know how to analyze, at least some of us.
Yeah. Yeah.
Can't
So, not for everybody.
Yes.
So I know we've had a viewer that has been hanging on through this. So I don't know. Oh, and they just fell off. How funny.
Oh, that's funny.
They're
like, don't talk to me.
Don't ask me anything. I was just see if they had any questions.
Yeah.
All right. We probably have about 3 minutes if you wanted to tack on.
I don't know what else really to chat about without questions. I mean, really just, I think the bottom line is that naturopathic doctors are trained to be primary care, and then we kind of specialize or niche out from that depending on our patient population, what we're passionate about treating. So one doctor is not going to be the same as another doctor. I've seen a few people that have been to other naturopaths and they're, with me now, or I'm sure some of my patients have gone to other docs, it just happens. So as always, if you haven't found the right fit with a provider that's willing to do their due diligence and willing to partner with you as a team to get you feeling better and as optimized in your wellness as you want, then look for a different one. There's so many docs. You do not have to have subpar care or be traumatized by doctor's visits or be not believed or not listened to. So, and we have all of these different tools that we talked about today to use to help treat you. So there's so many different things. We don't have to do everything at once. We can go as slow as you want, do as much as you want, but there's really always more options. There's always more testing.
Yeah. And my experience and understanding of a big difference between the Western and Eastern medicine is, and it's not that Western medicine doesn't aim to cure. So don't misinterpret what I'm about to say. But a lot of Western medicine response is focused on a symptom and healing a symptom versus healing a cause. Whereas naturopathic medicine is very focused on what is the cause, hence why there's so much testing. And I'm going to tell this story, and I'm very grateful this doctor was willing to do this, but it's proving like the opposite of it. But so I constantly was getting colds. This is a while ago. I was in my young 20s, and I got a cold all the time. The moment I was stressed out, I got a cold. The moment I wasn't getting enough sleep, I got a cold. I was getting colds all the time. And so I was going to a regular doctor, a Western medicine doctor, and they're like, it's a cold. We cannot help you. I'm like, okay, but this is like my 52nd cold in the last 3 months. I'm losing my mind. So he's like, well, we're going to put you on an allergy medicine to hide the symptoms. It's not going to heal you.
Right.
But you'll be able to function. And I was like, I just want to function. I don't care. I don't care if you fix me. Yeah. Just let me live. But that's, as much as I was grateful for it, did we know why I was getting all the colds? No. Did we actually fix that? No, if I went to a naturopath, they would have been like, well, why are you getting all these colds? Let's
Right.
run some tests.
Right.
So I think that's the biggest difference between the two.
Yeah.
A naturopath, in my experience, is very quick to supplement, and a
Mhm.
medical doctor of the Western side is very quick to medicate.
Mhm.
So
Yep.
you're going to take a pill of some form. It's just a matter of whether it's a prescription or if it's a supplement.
Right. And whether
If you're going
it's
to take one or 15.
right, right. Whether it's something that's gonna help your body heal and help us figure out what's wrong, or whether it's something that's gonna suppress the symptom, which we're taught, the body will find a new way to communicate. You suppress your abdominal pain, you're gonna get a rash. You suppress the rash, you're gonna get a headache. And then you'll just be on. That's how many people, that's why we get these polypharmacy patients, people taking so many different things because they started one pill, had to take a side effect pill for the next thing, and then something else popped up and all the things. So if you're somebody who just wants to feel better right away, you want a pill that's going to suppress something, visit an MD or a DO or a nurse practitioner, with their standard trainings. If you want to find the why, if you're like, but why? But you're, a 3-year-old, why? But why? But why? Then visit a naturopathic doctor.
Yeah.
Yeah.
Well,
Cool.
awesome. Thanks,
Yeah.
Dr. Katie.
Of course. Thank
Guys,
you.
as per usual, if you have questions after this, because you're an afterwards watcher, Dr. Katie and I are always staying up to date on the comments. So just ask your question there or reach out to one of us directly. Inclusive Natural Medicine is Dr. Katie's practice. Love Yourself Lean is mine. If it comes to naturopathic, obviously go to Dr. Katie. That is not my area of expertise. Whenever anybody has a naturopathic issue, that's when I'm like, okay, I have someone. So you can just always reach out directly or comment in the box. But hopefully you found this helpful. It did me, because there's just so much out there, and I believe it's important. My job as a patient is to ask smart questions, and I can't do that if I have no idea what I'm asking about. So this is helpful.
Good. And hopefully your doctors are telling you, so I'm glad that you found it helpful. Hopefully you guys did too.
Yay. All right, guys. Well, have a great rest of your day, and we'll see you in a month. Bye.
Bye.